So we are going to move on to our first panel discussion, and I would like Max King, the moderator, to please come to the stage, and he will bring on his panel. We're fortunate in Pittsburgh to have Max King. He cares deeply about our community. He's the head of the Pittsburgh Foundation, which is doing tremendous work in our community. Every city should have a foundation like that and a person like Max King to lead it. And thank you very much for being part of the conference today. And I will turn this over to you.
Great. Can my panelists come on up? And we'll take seats here on the stage. I'm going to sit here, and Brian, you can be here. Donald, Harun. Good morning. It's a great pleasure for all of us to be here today, and an honor for me to moderate such a distinguished panel. Everybody in this room, all of us, together in the last 20 years have gone through an extraordinary transformative period of time, and it's changed our lives. It's changed how we work, it's changed how we live, it's changed how we deal with people, it's even changed how we think. And it's the result of two powerful historic trends. One, of course, is the explosion of technology, particularly communications technology, but also medical technology, educational technology, all sorts of other kinds of technology. And the other, of course, is globalization. The rapid, dramatic, relentless interconnectedness of everything in the world, whether it's culture, commerce, business, academics, politics, entertainment, everything has become globalized. And all of you know how much it has changed your lives in terms of how you work and how you live. The impact of these two trends has been profound on healthcare, beneficial in many, many ways, but also disruptive in many, many ways. And that's what I think we want to talk about today. We've got an exceptional panel of experts, thank God, because I'm not an expert in this field at all, but I can fake it and ask questions. And I'll introduce them very, very quickly right now. We have Dr. Donald Fischer, who's the Senior Vice President and Chief Medical Officer at Highmark here in Pittsburgh. Mr. Harun Rashid, who's the Vice President of Global Health Services and Chief Information Officer at Children's Hospital of UPMC here in Pittsburgh, sitting very amicably together here on the stage. And Mr. Brian Mulligan, who's the President and CEO of Assist America, an emergency travel assistance organization in the Middle East, North Africa, and other parts of the globe. We don't have a great deal of time, so I don't want to take part of it with each one introducing themselves in terms of their biography. You've got that material in your folders. I would rather go right into questions that will be revealing in terms of their work and their perspective. And Donald, I'd like to start with you, if I may. As we know here in Pittsburgh, Highmark's gone through tremendous change in the last 10 years. Your business really has been reshaped in a variety of very important ways. I'd like to hear you talk a little bit about the role that technological change has played in that, both communications technology and medical technology.
Well, to level set for the group, first of all, health insurance in this country is probably what you'd see as an aberration. It's a situation where private insurers provide a service to individuals and to companies so that they can be assured of having health insurance. There are also government programs that we partner with. And of course, there's this cohort of people who are uninsured who are now entering the market through private insurance. Your question about technology is critically important, both on the provider side, the people who are delivering the care, and the insurers who are able to analyze some of what's happened through their claims data. Data is absolutely critically important to be able to drive improvement in healthcare. And for very, very long, physicians, hospitals had very limited data as to how they were performing, how patients actually followed up on getting the care that they had prescribed. Health plans, on the other hand, had claims data that showed, well, yeah, they did fill the pharmacy prescription, they did get the drug, or they didn't. And as we gather more data and we can analyze that, we can really look at what's more important. How did populations of patients actually improve their health? How did individuals improve? Are the outcomes better if it's done in this setting versus another setting? And so the data and the analysis, the analytics become critically important in differentiating providers, differentiating processes. And ultimately, where we need to be is how do we pay differently based on better outcomes?
Now, has this dramatic growth in the availability of data and the ability to analyze it, is it having a similar impact in the Middle East, do you think?
I think these are universal technologies. No matter where you go, people have access to data, to the internet. It is not something you hold close as a strategic advantage, and I think it needs to be used across a community, across a country, across the world in a way that is more disciplined.
Thank you. Harun, I'd like to turn to you, if I may now. UPMC and Children's are famous for innovative use of technology, and of course UPMC has hospital systems in other parts of the world. I'd like to hear you talk a little bit about how you see the evolution of UPMC's use of technology being of interest or benefit to companies and governments in the Middle East.
Thank you. From UPMC's perspective, we really believe that patients should have access to the best care in their country without having to leave the region or the country. And that's sometimes not possible because what happens is some of those care is not available. So UPMC is bridging the gap between international communities and UPMC to ensure that we are able to provide that level of care through telehealth technologies. And we talked about transformative technology, transformation, and that's what's happening around the globe as we look at new way of delivering medicine, and telemedicine has played a significant role. When you look at the UPMC International Services, we have hospitals overseas that we are managing, as a collective effort from the regions to ensure that we train the physicians on the ground, we train the nurses, we train the technicians. They come to Pittsburgh, we do a lot of training and education, and then we work together through the use of telehealth technology to deliver that medicine in their home country. We collectively manage whether it's a stroke program or even something as simple as a telepathology slide that can be sent all the way from China to UPMC, and within minutes we are able to look at that information, diagnose, provide a consult, and ensure that proper treatment is provided. Now, that is not always the case in most cases. In some cases, those patients are not able to travel, so we have to keep them in the home countries. But patients that do have very complex chronic disease and for which treatment is not available, we work collectively with their team to ensure that those patients come to Pittsburgh and treated just like we would treat our citizens here. But telehealth has been the new wave of how we deliver medicine, and it will continue to grow, not only just around the United States, but around the world, because that's the way it's going to make things easier for us to connect with different parts of the world.
Just a quick follow-up on that. UPMC built a reputation early on for being one of the first systems to open up facilities abroad. And that looked like a pretty robust strategy for UPMC. But is the ground shifting now to where you will be less likely to open up facilities abroad and more likely to use telemedicine to serve other countries, particularly in the Middle East?
I think it really is based on the region we're trying to go in and work with. Some regions have sophisticated technology and it's possible to do certain things, but not everything can be delivered over telemedicine. When we talk about oncology, as we are doing in Kazakhstan or Lithuania or Colombia, we actually have to have physical presence on the ground to ensure, so it's possible that some of the services can be provided with having personnel on the ground, and some of the services can be performed by having telehealth as a vehicle to provide those services as well as an extension of that services. So I think it's a mix of both. In certain cases like in Colombia, and you'll see that in my presentation, we're managing patients directly from Pittsburgh, 3,200 miles away in an ICU, but that's not always the case in other specialties. So I think it's a mixture of the region where we are going into, how sophisticated the technology is in that region, so that we can connect them to all the different components of UPMC, and also ensuring that how much we have to do uplift in that country to ensure that we can help them with training and education, which does require us to sometimes be on the ground, and at a distant future we can slowly disengage and they can take on more of the responsibility in those countries.
Do you sometimes find yourself making a choice between opening a facility in another country or helping provide them with the technology to do telemedicine?
We seldom ever go in and say we want to open a facility somewhere. We always look for partners on the ground. It is very important to us for our mission to ensure that we have a local partner who understands the culture, the socioeconomic, and the delivery mechanism that is needed. So we partner with the local communities, and they're the ones that reach out to us actually to say, what can you do to help improve our healthcare in our country so that we can have the same level of or same degree of quality and innovation that UPMC is known for around the world? So we do work with local partners when they reach out to us, and if it's a good business alignment for UPMC, we will then work together with those institutions.
So some opportunities for countries in the Middle East.
Absolutely.
Brian, I'd like to turn to you for a minute now, and I've got a question, but first I wanted to ask you to quickly give us a description of what a travel assistance company like yours does and how you fit into the field.
Sure.
Very briefly.
Thank you. We're a global medical emergency services company. So what we do is if we have members that are traveling anywhere in the world and they become sick or injured or have any kind of travel difficulty, they can contact one of our operations centers and we intervene and provide support. That support could include medical evacuations, medical and non-medical repatriations. In the case of death, we handle the return of mortal remains, and there's a bunch of other services that we have to ease the pains of travel globally. So we have about 34 million members across the globe, with about 8 million members concentrated in the Middle East.
Thank you. I want to ask you a question about a shift in communications technology and how it impacts your work all around the world. We're all familiar with the shift from the desktop to the laptop, now to mobile devices, and how that's changing how people get information, interact, get assistance. I'm wondering how this shift to mobile devices impacts you and how you respond to it.
Yeah, it's really been a big change in the assistance business. 40 years ago, 30 years ago, even 20 years ago, assistance companies needed to be having 60, 70 operation centers scattered across the globe because you needed to be on the ground to be able to handle problems. Today, after the world flattened, as Thomas Friedman told us in 2006, and the advent of the iPhone just in 2007, we all became very connected, and we are now able to have very concentrated operation centers where we have massive language capabilities to be able to service the business across the globe. For example, our Middle Eastern business is serviced from an operational standpoint 100% by our people in Princeton at our corporate headquarters. So we have complete Arabic speaking, we have all the advantages that we need to be able to service that business at the highest level possible. So with this technology has allowed us to collapse those bricks and sticks places, bring it all under one house, and be able to really ensure a higher quality of service, because I think those of us in business know that if you have 5 or 6 bricks and sticks places, operation centers, it's much easier to control the quality than having 60 or 70 of them.
Tell me a little bit about how it's different to operate your business in the Middle East than some of the other parts of the world.
Yeah, it's a good question. I think that from an American standpoint, we think it's going to be much different to do business in the Middle East. But I've been in the Middle East for about 10 years now, and one of the things I've learned is the same issues and concerns that drive people, that drive decision makers in the Middle East are the same that drive the decisions and everything else that happens in the United States, whether China, the subcontinent of India. Basically, there's a sameness. As long as you recognize the culture that you're working with and appreciate and understand, and as we heard earlier today, if you listen and understand and sympathize, then you can succeed. So while the Middle East is different in the sense that the business leaders may have some skepticism about certain preconceived notions of how we work, ultimately there's a extreme confidence in the types of services that we can provide, because we are a United States company and deliver, I guess, first-class services and stand behind what we do. So I think there's not much difference from doing business in the Middle East and doing business in China or in India or in Indonesia, places like that. I think there's very much a similarity. People have to understand that fundamentally, people care about themselves, their families, and the people they love. And as long as you have those things in mind, there's very much a sameness that goes on across the globe.
Interesting, very interesting. Donald, Highmark's an insurance company that has now gotten into the hospital business, is a provider of medical care. And I'm curious to know how technology, the changes in technology, informed your decision to go ahead and become a provider of healthcare and take on a hospital system that has some challenges, needs your assistance to improve, and then also whether this embrace of both aspects, insurance and medical care, is leading you toward global markets in any interesting ways.
Yeah, it's an excellent question about integration. So healthcare has been very siloed. We are seeing increasing consolidation in this country with regard to providers, and that is primary care and specialty care, hospital care. When you talked about facilities earlier, I think we are going to see fewer and fewer facilities built. There may be upgrades for certain kinds of technology that are needed for high-end tertiary quaternary care. But I think more and more care is going to happen out in the community using the kind of telehealth technology that you talked about a little earlier. That integration of technology and meeting people where they are, really being truly patient-centered, means that all the people who have a piece of this action, whether it's insurer, hospital, the community, the patient, that we meet patients where they are and make the patient experience better. For many people, once the diagnosis has been made and the plan's been put in place, there's really no need for them to have to physically make a visit to a doctor. You could manage this remotely. You can do home monitoring using technology, which is readily available now.